My name is Jayla Moss, and I will be discussing eating disorders. My group members include Kalia and Nikel as well. So, what is an eating disorder? An eating disorder is a mental illness that people sometimes use to manage their feelings. If you have a disorder, typically that means, or eating disorder, typically that means that you have an unhealthy relationship with food. This may be eating too much food or eating too little food. Eating a lot of food in one sitting can be damaging to you physically, emotionally, psychologically as well. Um, Eating disorder is or can be a step to obesity or anorexia. It also deals with an obsession of how your body is shaped and what type of foods um, give your body the effect that you would like to give your body. There's also something called disorder eating. So, disorder eating is an abnormal behavior that can be very dangerous. It typically involves different eating behaviors. Disorder eating includes unhealthy and unhealthy eating disorders. They're usually done or they usually come about when a person is trying to lose weight or have a healthier lifestyle. But sometimes doing it or going overboard with it can make a or cause a significant impact on your life. It can lead to several complications. It's also a warning sign. It can be a warning sign for eating disorders. Disordered eating is extremely common. This is due to disordered behaviors in mainly the Western cultures. Some common examples of eating disorders would include cleanses and skipping meals and diet pills as well. So, the difference between an eating disorder and disordered eating, some of which include eating disorder, mainly, this is a physical or psychological harm that can be done to oneself. Um, and disordered eating is mainly a pattern of unhealthy eating behaviors. So the thing that makes them different in regards to an eating disorder, thoughts of generally consuming all of your food or either having a certain amount of calories that you would like to intake. It also includes food avoidance and where you buy your food at as well. This all falls into an obsession basically. It can impact your focus, your ability to be present in your waking life and your sleep and a whole lot of other things as well. Um, a lot with eating disorders, they put a lot of time into thinking about food and how much food they should take and what they should do to basically put out the food that they just put in a certain amount of time. And all of this also involves with eating disorders a lot of isolated or isolation as well. Eating disorders can interrupt someone's personal life, family, friends. Eating disorders are not choices. They can be biologically influenced illnesses as well. And also, eating disorders they affect all genders, all ages, races, body shapes, weights. Anybody can have a eating disorder. With disordered eating, it is used to describe a range of irregular eating behaviors. They don't really have a diagnosis for a specific eating disorder. Many individuals who have disordered eating, they're diagnosed with a eating disorder, but not specified column. So basically, they have some type of eating disorder, but it's not a specific, they don't fall into the category of a specific eating disorder, but they do show signs and symptoms of those behaviors. Um, there is an American Psychiatric Association. This basically is a criteria for eating disorders, and this is what draws the line between disordered eating and eating disorders. In some cases, there is individuals who have disordered eating patterns and may fit into the criteria of the American Psychiatric Association, but it is possible to have those patterns, but they are not confined of an eating disorder diagnosis. Eating falls shortly under um, treatment as well into problematic eating disorders. So, a disordered eating can definitely put someone into a chronic health condition in which they could have a chronic weight fluctuation. They could have emotional issues as well. They could have frequent dieting, not eating at all, over exercising, not exercising as well. There are also different types of eating disorders. Some include yo yo diet, counting calories, food restrictions, and rigid food and exercise regimens. Disordered eating also typically includes food obsession, distorted body image, social anxiety. They also can sometimes have poor self esteem as well, and they have a big fixation on their weight. So typically, disordered eating mainly includes the physical and psychological aspects of eating disorders. They typically would have up and down weight. Acid reflux is a big one, being that they either like have a behavior of where they throw up their food after they consume a large amount of food just to make sure that their weight is at a certain number at all times. And disordered eating, it has many signs and symptoms, or signs and symptoms that mainly target the physical and psychological aspects of eating disorders. So, types of eating disorders, there are a lot of eating disorders around the world. Anybody, like I said before, can develop an eating disorder. A few order or types of eating disorders would include anorexia, which is a very, very, very common one. The next one would include bulimia, and the other one would include binge eating disorder, and also OSFED.